I'm Dr. Catherine Harris. Today, we're going to talk about a topic that many people are curious about but rarely discuss with good evidence-based information: semen volume. You'll hear a lot of myths online about how to ejaculate more, but very little context about what's normal, what actually influences volume, and, most importantly, what's healthy and safe for your body in the long run. My goal is to give you a calm, practical guide so you understand what's happening, what you can realistically influence, and when it's wise to speak with a clinician. First, let's set expectations. Semen volume is naturally variable. It can change from day to day and even from one occasion to the next in the same person. Hydration, the time since the last ejaculation, stress levels, sleep, medications, and overall health can all play a role. A bigger volume isn't a measure of masculinity, health, or fertility by itself. The body's reproductive system is much more complex than a single number, and a healthy sexual life is not a competition. To understand what might help, start by understanding what semen is. It isn't just sperm cells. Sperm are produced in the testes, but most of the fluid comes from the seminal vesicles and the prostate. Those glands contribute sugars, enzymes, and substances that help protect and transport sperm. That means the parts of your lifestyle that affect your hydration, your metabolism, inflammation, and the health of those glands can influence semen volume. Let's talk about the straightforward things first. Habits that support general reproductive health and may, in some people, support a fuller ejaculate. Hydration matters more than most people realize. Semen is mostly water. If your urine is consistently very dark, you're likely underhydrated. Aim for a pale straw color most days. Spread your fluids through the day rather than chugging all at once. Water is best. Sugary drinks can spike and crash your energy and aren't doing your glands any favors. Caffeinated drinks count toward fluids, but too much caffeine can increase anxiety for some people, which may reduce sexual function overall. Keep it balanced. Nutrition is the second pillar. The glands that make seminal fluid respond to the same dietary pressures as the rest of the body. Focus on a whole food pattern: vegetables, fruit, legumes, whole grains, nuts, seeds, and quality protein sources. Healthy fats, like those from olive oil, avocados, and nuts, are helpful for hormone production. Micronutrients associated with reproductive health include zinc, selenium, folate, vitamin C, vitamin D, and antioxidants. You do not need megadoses, and you should not take random supplement stacks based on social media. Food first is a safe rule. If you're considering supplements, do that with a clinician, especially if you take any medications. Body weight and metabolic health matter. Carrying excess visceral fat can shift hormones in a direction that isn't helpful for sexual health. You don't have to chase extremes. Even modest, sustainable changes, like adding a daily walk, choosing water more often than soda, or prioritizing a vegetable at each meal, can reduce inflammation and support normal function of the prostate and seminal vesicles over time. Exercise is your third pillar. Regular physical activity improves circulation, supports a healthier hormone profile, and reduces stress. You don't need extreme routines. A blend of brisk walking or cycling with a couple of strength sessions each week is a great baseline. Be careful with cycling seats that put too much pressure on the perineum for long durations. If you cycle a lot, invest in a good saddle and adjust your position for comfort and blood flow. Sleep and stress are underrated but powerful. Your reproductive system is sensitive to stress hormones and sleep debt. Chronic stress can dampen sexual desire and make arousal and orgasm less reliable. Protecting your sleep, regular hours, a dark room, fewer late-night screens, pays dividends. For stress, use techniques that are simple and repeatable. Diaphragmatic breathing, a short mindfulness practice, light stretching, or journaling. If you enjoy meditative traditions, some people find that body awareness practices help them feel more connected to their arousal cues, but keep expectations realistic and avoid practices that promise miracle changes. Now, a quick word about timing and frequency. If there's more time between ejaculations, volume typically increases. That's normal physiology, not a trick. On the other hand, very frequent ejaculation usually means lower volume each time. There isn't a right schedule. There's the rhythm that suits your life and feels comfortable. What you don't need is rigid rules. Your body isn't a stopwatch, and forcing extremes, very long periods of abstinence or obsessive schedules, doesn't make you healthier. If your goal is a fuller ejaculate for a specific reason, a short period of abstinence can do that for most people without stress. Keep it simple. Heat exposure is another practical factor. Sperm production prefers cooler temperatures than core body temperature. Prolonged exposure to high heat, very hot baths, hot tubs, placing a laptop directly on the lap for long periods, heated car seats on high, can affect sperm parameters over time. This is more about fertility than immediate volume, but it's worth noting. Avoid regular, prolonged high heat exposure to the groin. Let's talk about substances and medications. Tobacco, heavy alcohol use, and some recreational drugs are linked with poorer reproductive parameters. Anabolic steroids and pro-hormone supplements are especially risky. They can shut down your body's own hormone axis, shrink the testes, and reduce both sperm and semen volume. If you've used them, it's important to be honest with your doctor. Recovery can be slow and needs proper medical guidance. Some prescribed medications can reduce ejaculate volume or alter ejaculation. Common examples include certain antidepressants, some antipsychotics, blood pressure drugs, and medications used for urinary symptoms related to the prostate. One well-known example is tamsulosin, which can cause dry or very low-volume ejaculation by relaxing the bladder neck, allowing semen to flow into the bladder instead of out. This is called retrograde ejaculation. Never stop or change medications on your own, but do bring any concerns to your clinician. There are often alternatives. Pelvic floor health is another angle. The same pelvic floor muscles that support continence also coordinate the rhythmic contractions of ejaculation. If those muscles are weak or out of sync, the sensation and force of ejaculation can feel blunted. Gentle pelvic floor training can help some people. The idea is simple. Identify the muscles you use to stop urine midstream. Then, away from the bathroom, practice brief, controlled contractions and full relaxations. Start with short sets during the day. Focus on quality rather than intensity, and avoid holding your breath. Overdoing pelvic floor work can backfire by creating tension, so keep it light and consistent rather than aggressive. If you ever have pain or persistent tension in the pelvic area, a clinician or pelvic floor physiotherapist can guide you. Now, let's separate facts from hype. You'll see claims that certain herbs or powders dramatically increase semen volume. Evidence for most of those claims is weak or mixed. Some nutrients like zinc, selenium, CoQ10, L-carnitine, and vitamin D have research in the context of male fertility, but that doesn't translate to quick, large changes in volume for everyone. Supplements can also interact with medications and aren't regulated like medicines. If you choose to try something, do it the same way you'd test a new exercise plan, one change at a time, reasonable doses, and a check-in with a healthcare professional, particularly if you have any health conditions. What about techniques you might have heard from meditative or Taoist traditions? Some people train to separate the sensation of orgasm from ejaculation or to delay ejaculation. These practices are framed as ways to regulate arousal and conserve energy. Scientific evidence is limited, and results are highly individual. If you're curious, approach them as mindfulness exercises, not as medical treatments, and steer clear of any group or teacher that pushes extremes, makes medical claims, or asks you to ignore pain or discomfort. Your safety comes first. There are also medical reasons for low volume that deserve attention. If your ejaculate has been consistently very low for months, if you notice painful ejaculation, blood and semen, burning, fever, pelvic or testicular pain, urinary symptoms, leakage after you feel done, or if you've had pelvic, prostate, or bladder surgery, please speak with a clinician. Causes can include hormonal issues, inflammation of the prostate or seminal vesicles, blockage of the ejaculatory ducts, retrograde ejaculation, nerve issues related to diabetes, and medication effects. These are not problems you push through with tricks. The right evaluation can make a real difference. If you're concerned about fertility, remember that semen volume is just one piece of a larger picture. Sperm count, motility, and morphology are more relevant to chances of conception. A standard semen analysis can provide an objective snapshot. If you ever pursue testing, be sure to follow the collection instructions exactly. Small differences in timing and handling can change the results. Let me give you a clean, healthy, realistic plan you can start today. It's not dramatic because your body doesn't need drama. It needs consistency. Drink water regularly. Keep an eye on urine color as your daily guide. Balance caffeinated drinks and avoid high-sugar beverages most of the time. Build your plate around whole foods. Aim for a colorful vegetable or fruit at most meals, include a source of protein, and don't fear healthy fats. If you're not getting much seafood, consider talking with a clinician about omega-3s. Move most days. Mix cardio you enjoy with simple strength work. Protect comfort and circulation if you cycle a lot. Protect your sleep window and wind-down routine. If stress is high, pick one stress reduction tool you'll actually do. 5 calm breaths before meals or a 10-minute evening walk is a perfectly good start. Avoid tobacco and limit alcohol. Skip quick fix hormones or black market supplements completely. They can do long-term harm. Be thoughtful about heat exposure. Occasional hot showers are fine. Daily, prolonged, very hot soaking is not ideal if you're trying to optimize reproductive health. Keep a simple note on your phone if you're making changes, what you adjusted, and how you felt after a few weeks. Your body responds to trends, not to a single heroic day. What should you avoid? Avoid extreme abstinence challenges, drastic dehydration or overhydration, unsafe supplements, and any practice that causes pain or numbness. Avoid content that shames you or tells you something is wrong with your body if you don't match a certain image. Bodies vary, and variation is normal. If you've recently started a medication and noticed a change in ejaculation or volume, don't be embarrassed to bring it up. Your healthcare provider can only help with what they know, and medication-related changes are common and often reversible or manageable with adjustments. There's a final point I want you to hear clearly. A caring sexual relationship, beginning with a caring relationship with yourself, doesn't measure worth in milliliters. Confidence and well-being come from understanding your body, taking care of it, and asking for help when something feels off. If you do those things, you're already doing what matters most for your reproductive health and your long-term vitality. If you want this talk adapted into a voice-over script with a strong opening hook for YouTube, keeping the title Cómo aumentar la cantidad de semen, qué hacer para eyacular más, but presented in English, I can craft the exact pacing, retention cues, and time-stamped segments next.